Hey there, it's Dr. Jim. Thanks for stopping by. I have a serious topic today, and one that I have become increasingly interested in. It is a neurodegenerative disorder, and it is a devastating disorder that affects many people, their lives, their quality of living, their families, and that is Huntington's disease. So, my topic today is managing Huntington's disease in senior care. What is Huntington's? Let me give you a nice overview of what this disease is really about. Huntington's disease is a slowly progressive neurodegenerative disorder that involves degeneration of neurons in the brain that leads to numerous physical, behavioral, cognitive, and emotional changes. It involves gradual changes in the person's ability to control movements of the arms, legs, trunk, tongue, and eventually even their lips. Buddy, settle down back there. Can you see Buddy? I don't know if you can see Buddy. Anyway, he's moving around. He had to come in. Buddy's got to be with me at all times. If you watch many of my videos, you know that Buddy is very close, near me at almost all times. But changes also take place in mental functioning, learning, and memory. Huntington's affects so much. The individual will experience varying degrees of changes in emotional state, mood, psychological, and even psychiatric disturbances. And I have seen these. And they're very difficult for the patient, the person. And they're hard to watch if you're a family member as well, or a caregiver. So the disease is caused by a defect in a gene called Huntington. That's where it gets its name. Everyone has 2 copies of this gene. But anyone who inherits the defects in one or both genes will develop Huntington's disease. This is a disease that passes from generation to generation. It's genetic and familial. And individuals who are going to get married, and one of the partners has Huntington's, it is generally suggested or encouraged that they get genetic counseling, because the chance of them ending up with a child or children, multiple children with Huntington's, is relatively high. So Dr. George Huntington was the very first one to describe the disease way back in 1872, believe it or not. At first, the disease was called Huntington's chorea. And I remember that very, very well. I used to own and operate a geropsychiatric clinic, and we probably serviced 100 nursing homes, assisted living, group homes. And that's what our psychiatrists were calling it back in the 90s. Huntington's chorea, because chorea means the movement dysfunction part of the disease. We now know that the disease involves much more than problems with movement. Motor, cognitive, psychological, and behavioral problems are also characteristic of the disease. And according to the literature that I've been reading, this disease can last anywhere between 15 to 20 years. And that's a long, long time to suffer with a neurodegenerative disorder. So, Huntington's is a neurodegenerative, just like Alzheimer's disease is and Parkinson's disease. But one of the hallmarks that differentiates Huntington's from the others is that it's diagnosed much earlier in a person's life. Younger people can be diagnosed. As a matter of fact, the typical age at onset is between 30 to 40 years of age. So think about that. You could live from 30 to 50 with Huntington's, or 40 to 60 with Huntington's. That's the end of your life. You know, the end of our lives are supposed to be, if I'm going to get romantic about it as a gerontologist, our golden years. There's no other time in life after retirement, where we have all of these years to do what we want, go where we want, as long as we're healthy, and we have some resources, we have someone in our life. It's a terrible way to end one's life. So I'm going to stop there. Thank you very much. This was Managing Huntington's Disease in Senior Care, and I'm Dr. Jim. Take care.